controversial. A little bit comes out that shows it might show a slight improvement in decreasing relapse rate, but for the most part, I'm not yet sold that those medications do a whole lot. And there's 3 or 4 of those that are out there. I think there's nothing that really takes the place of having a good recovery program. I don't think the long-term data, well, actually the data for those medications are not particularly long-term. That's one of the problems with it. It doesn't go out 2 years or 3 years. It's like 6 months at the most. Yes?
Yeah, I'm having trouble getting my hands around this with this very physiological model that you're presenting. Treatment and a recovery program is primarily a talking cure.
Right. Yeah, why does it work? Well, it's a great question because I know a lot about the neurobiology of addiction, and I've shared some of that with you. I think, and correct me if I'm wrong, we don't know a lot about the neurobiology of recovery. We don't know how it works. We don't know what centers are turned on. We don't know exactly how that process works. But it seems to. It definitely does. And you'd think that if we know about the receptors and all the stuff in the brain, shouldn't we be able to come up with a drug that could fix this problem? Wouldn't it be great to have recovery in a pill? That'd be wonderful, right? And the fact of the matter is, it's a complicated system that I don't know if we'll ever get to that point. We may, but the way that most drugs work now, they're far too nonspecific. They don't focus directly, and that's not something that we have available to us to decrease the craving. But it seems to work. It seems to work. I mean, there's a whole psychological approach why that might work. But again, even the 12 steps and talking therapy don't mean the same thing either, and they both seem to work well. Yes.
Was Vicodin or any kind of opiate ever supposed to be used like long term, or was it intended for like short periods of time? Great
question. I think that short-acting opiates, which means they last for about 6 hours, the cutting edge in pain medicine now says don't use them for long-term pain use. That's where we are now. So your suspicion is actually very forward-thinking. However, the way that doctors learn, we learn how to treat pain. It's basically, if something hurts, they come into the office, give them some Motrin. If they come back, give them Vicodin. If it keeps hurting, give them more Vicodin or something stronger. If it hurts more, give them more, longer, stronger. And there's no real exit strategy for that, which is a topic of a completely different talk.